Whether you're fighting, healing, caregiving, treating cancer, or simply searching for hope, this space is for you. Welcome to FU Cancer, where meaningful conversations meet powerful community. My name is Juliette Jorgensen. I'm your host, a registered dietitian and cancer advocate, and together we're turning challenges into connection. Check out our platform on the web at fucancer.health. Welcome to the FU Cancer podcast. Today we are joined by Dr. Jennifer Vencill, a board-certified clinical health psychologist, AASECT-certified sex therapist, co-author of the newly published book named Desire, an inclusive guide to navigating libido differences in relationships, and an educator at Mayo Clinic. Please note that she is speaking on the podcast as an individual and not on behalf of Mayo Clinic. Dr. Vencill teaches medical professionals how to approach sexual health with skill, sensitivity, and inclusivity. She works with all patient populations and more specifically with cancer patients, caregivers, and survivors, bringing deep expertise to a field of medicine that remains underserved and in need of more trained specialists. In this episode, we will be focusing on whole person care, specifically speaking to those medical professionals who weren't provided training on sexual health in the setting of a cancer diagnosis. Our goal is to close important gaps, build comfort around challenging conversations, and better meet patients where they need us most. So excited to have you here, Dr. Vencill.
Thank you for having me.
Of course. Let's kick things off by having you tell us a bit about yourself and what inspired you to focus on sexual health as a profession.
Thank you. And thank you for that wonderful introduction. Yes, I'm a psychologist who specializes in sexual health. I'm a sex therapist, if you will. That has, over the course of my career, led to a lot of different directions, but I find that more often I am working with cancer patients, cancer survivors, their partners, at that intersection of oncology care, survivorship, and sexual health concerns. So that is where we're at now.
Incredible. Thank you, and much needed. Could you start by briefly explaining sexual health and sexual dysfunction, especially in the context of cancer for both patients and caregivers?
Yeah, big question, of course. We could spend a lot of time talking about that. But in general, thinking about foundations here, we know that sexual health is more than just the absence of dysfunction or disease, right? We think about sexual health holistically. This includes functioning, of course, but also things like satisfaction and being able to communicate about sexual health, whether that's with your care team, medical providers, partners. So thinking about sexual health holistically. When it comes to that intersection of cancer, there are often functioning impacts, as I know we'll get into today. The biggest place to start there is recognizing that there's kind of four general domains of sexual health that we're looking at in terms of functioning impacts or disruptions with cancer care. So those are arousal. These are kind of the physiological aspects of sexual functioning. So erectile functioning, vulvovaginal lubrication or dryness, right? Orgasmic or ejaculatory concerns. So sounds like what it is. Particularly impacted, for example, with prostate cancer care, prostatectomies. Desire, also known as libido, that's kind of the wanting, the interest in sex that can be compromised by so many aspects of cancer care, much less other aspects of our life and relationships. And of course, the fourth domain is pain, ideally an absence of pain during sex, but something that's really, really important for care teams that are working with cancer patients to be assessing for, because sexual pain can really develop during treatment quite easily for many of our cancer patients.
Yeah, I love how you broke down each of those topic areas of concern. And I'd love to know more about how specifically chemotherapy, surgery, or radiation perhaps might influence sexual health and what you just explained.
Yeah, so when we think about this really important intersection of cancer care and sexual health, there can be very clear direct impacts of treatment, right? So radiation to the pelvis that can create injury, that can knock people into menopause. Certain cancer-fighting medications can do that as well. As I mentioned, prostatectomy can really interfere with ejaculatory functioning, sometimes erectile functioning. So these are very direct impacts of treatment. It's also important to recognize that there are very clearly indirect impacts of treatment as well. So fatigue, nausea, just not feeling well because of chemotherapy, because of radiation, because of the treatment that you're on, isn't really doing a lot to make people feel super sexy and have a lot of libido, right? So we can see these very indirect effects of care as well. Certainly the overall stress and for many people trauma of getting a cancer diagnosis, of going into kind of survivor mode of, okay, I need to plan appointments, I need to get to treatment, right? That level of stress and anxiety in and of itself can disrupt sexual health apart from sort of direct surgeries or radiation or chemo. So we have both direct and indirect effects to be keeping in mind.
Absolutely. And then, what are some of the most common sexual health concerns that you encounter among cancer patients and survivors, both men and women?
Yeah, for sure, differences in libido between partners, sexual pain, vulvovaginal dryness, typically in the context of either a patient being put into surgical menopause or cancer treatment induced menopause, for example, aromatase inhibitors, things like that. So, libido concerns, sexual pain, really, really common for our patients with vulvas and vaginas. On the penile side of things, erectile dysfunction, very, very common. I would say for sure the number one thing we tend to see.
Absolutely, yeah. And for clinicians, how do you decide when it makes sense to manage a sexual health concern yourself versus referring the patient to a specialist like you to deal with some of these concerns that you just listed?
Yeah, I work within a medical team, so I'm the only psychologist embedded within a medical team, the sex therapist of the team. And I love that we can work as a team together, both my sexual medicine physicians, my menopause specialist, my pelvic floor physical therapist. It's so important to be working within robust teams because sex is complicated, right? It is biopsychosociocultural in nature. And so the question really becomes which part is your lane? So, as the medical provider, perhaps you are helping to treat vulvovaginal dryness or the genitourinary syndrome of menopause, helping provide PDE5I inhibitors, so medications to help with erectile functioning. If the patient needs additional care, though, thinking about either a sexual medicine specialist or if you're noticing more on the psychosocial aspect of things or you feel like there are cultural factors at play, really helping that patient find a local sex therapist for them to work with and helping them understand that that is not because they're doing anything wrong, right? Can we destigmatize that referral? There's so much misunderstanding about what sex therapy is and what sex therapists can be helpful with, that patient's going to look to you and ask, why are you making this referral, doc?
Yeah, absolutely. And so we know that clinician time is valuable and there's lots of information that must be covered in a relatively short amount of time during patient visits. During a clinic visit, what signs, cues, or risk factors should clinicians pay attention to that might point to a sexual health concern? And how can they explore those issues in a way that's efficient but still shows patients the topic really matters?
So tough, right? We all have such short, limited time with our patients, so much less time than we all want. One systemic way to approach this, if you have the power or some influence within your medical setting, is to actually start thinking about embedding questionnaires about sexual health and sexual functioning into kind of pre visit paperwork, right? So, having a checklist, there are numerous validated sexual health, sexual functioning questionnaires. Having something like that, the patient fills out before a visit, maybe an annual visit or a follow up visit. That way, it's already there. They're filling that out before they even get to you face to face so that you can save time there. But you can also check and see, okay, they endorse this item about concerns with sexual pain or vaginal dryness or libido concerns or orgasmic concerns since treatment. So we can kind of hone in and focus our limited time together. So if you have the power, doing something like that, very, very helpful. If not, though, right, the tool that I often recommend for our medical students, our residents, to kind of keep in their back pocket is a very simple phrase, right? It is many people going through cancer treatment have sexual health concerns. What concerns do you have? Right? Not the are you having concerns, yes or no, because we know what patients will generally say. Oftentimes
Mm,
they're just going to say, nope, doc, everything's fine. Don't really want to go there with you, right? We have so
right.
much stigma around this topic in our culture. Medical providers carry that stigma too. The research has been clear for 30 years that patients want us, the healthcare providers, the psychologists, the physicians, they want us to start the conversation. And so by starting with an open ended question, assuming that there are sexual health concerns, you're going to find out so much more than you were getting before, right? So again, that phrase, lots of folks going through cancer care, going through chemo, going through radiation, experience challenges or changes in their sexual health. What concerns are you having in that area?
Gosh, yeah, I love that. And I love that you provided such a simple yet really inclusive and great phrase for clinicians to ask their patients. I think that is super helpful to have in your back pocket. And I also love the idea about screening. I think that'll catch anything that falls through the cracks and those people that really need that care. So that's wonderful. And I understand you work with a wide range of cancers and a wide range of treatments. Are there certain types of cancer or treatments that tend to have more predictable sexual side effects that providers should keep on their radar?
Yeah, perhaps maybe the obvious kind of erogenous zone, so breast, chest cancers, any sort of pelvic or reproductive related cancer. That being said, though, if we kind of go back to what we were talking about the indirect effects of cancer care on sexual health, in some ways it doesn't necessarily matter where the cancer is located because of the side effects of chemo and radiation and cancer related treatment surgeries, that can be impacting libido for any cancer patient regardless of the location of their cancer. Of course, we're more likely to see concerns if it's a pelvic oriented cancer or a breast oriented cancer, because of the obvious use of those areas of the bodies. But with body image changes, fatigue, right, again, nausea with treatment, we actually might see sexual health impacted for any cancer patient. So I would actually argue that we should be screening across oncological patients.
Right. Yeah. I love that. Absolutely. For patients now, when would you say it's the appropriate time to bring up sexual concerns with their clinician after cancer
Mm.
treatment?
That's such a tough one, and one that we within our team actually talk about a lot. When should we be maybe moving up screeners or moving back screeners in the cancer care journey, right? Is it at the time of diagnosis? Is it at the first treatment visit? Is it when we're kind of in that quote unquote survivorship period and active treatment has ended? The reality is every patient kind of has a different preference around this. And so what I will often say to those patients is it ask about it, reach out to your care team when the time feels like it's right for you. I fully acknowledge that sexual health, sex may not be a priority. It might be so far down the list of priorities, especially early on in care when you are maybe recovering from the shock and the trauma of the diagnosis in the first place, just sort of getting your feet underneath you in terms of planning visits and mapping out a treatment plan. It is totally okay if sex is not at the top of your priority list at that point in time. Every now and again, though, I will meet patients who say to me, I should have known this on day one. I should have known that there was a sexual health clinic available to me. I should have known about sex therapist. I should have known about sexual medicine. So some patients do want that much earlier in their journey. It just depends on the person. And so making sure that we're continuing as healthcare providers to be asking patients about that and just sort of saying, this resource is available to you when you're ready to talk about that. I'm here to start talking about that. That might not be today, and that's okay too, but let's circle back to it next time you're here.
Yeah, yeah, I love that patient-centered care is it's so valuable across all disciplines in the healthcare field. So, yeah, I think that's great and having that conversation with your patient when they're ready for it and gauging that as a clinician as you shared is super valuable. So, thank you for that. That's so insightful. And so we also know that cancer can profoundly impact partners and relationships. What advice can a clinician who may not have a specialized training in sexual health after cancer provide to help couples navigate changes in intimacy together?
Yeah, much of what we've already talked about today applies here, right? So recognizing that not only is the patient going through physical changes, wellness changes, sexual health changes, their partner is often going through their own experience with the cancer journey. Different, but not necessarily more or less difficult depending on the couple, right? But depending on the partner. And so for the physician to just normalize, for the healthcare provider to just normalize, it is really common for there to be sexual health changes throughout this process. I'm here when you want to talk about that, and I probably will actually ask you from visit to visit how sexual health is going because we think that that's really important. We want to keep tabs on that. When you're ready to talk about that, we're here for you both to be talking about that. That becomes extra important for our patients that are in partnerships because when one partner tends to start having a sexual health concern, it's not uncommon for the other partner to as well. So a common example of this is cancer patient starts to have vulvovaginal dryness, pain with penetrative sexual activity, and her partner starts to develop problems with erections because he's worried about hurting her. And they're trying to navigate sexual pain. He's losing his arousal and erections. And so now we have to work with both partners to navigate sexual recovery and functioning.
Yeah, and thank you for giving Such a great example. I'm sure you see a lot of that, and a lot of patients struggle with that. So it's nice to know that there are clinicians like you out there and they're here for those patients. And thank you so much for answering that so beautifully. I'd also love to know what guidance you can offer survivors who may feel hesitant or anxious about discussing sexual dysfunction, changes in body image, or difficulty with intimacy with their care team.
Yeah, it's a wonderful question. I think part of this is we have to recognize for these patients, for these survivors, that they really might have to step up and advocate for themselves. I wish that wasn't true. But because we do such poor sexual health education still in the medical education world, and we're working on it, it's getting better. But because so many healthcare providers get limited training in sexual health, sexual medicine, menopause medicine, which is related to all of this, of course, even if patients are brave enough to ask, they might not have a provider that's informed enough to support them. And so, what I would say to those survivors and patients is that if you ask the question and your provider, brushes you off or says, don't worry about that, it's time to keep looking, right? It's time to keep looking for a provider or a care team who's going to take that care and that concern seriously. And we are out there, not as much of us as I wish there were, but we are out there. So those
Right.
survivors, those patients very likely are going to have to advocate for themselves and unfortunately might have to ask around to a couple different providers before they get the support that they need. I wish that that was not the case, but unfortunately it still is.
Right. Yeah, and that's super important, having that advocacy and empowerment as a patient. And then circling back to what you mentioned about that disparity that we have with clinicians and that lack of sexual health education in medical school, where can clinicians find resources to learn more about how to navigate this topic with their patients?
Great question. There are actually a few professional organizations to be aware of here. I would say the one that I've been most involved with is the Scientific Network on Female Sexual Health and Cancer. Still a very small organization, but a powerful group of medical providers, mental health professionals, allied health providers who are really, really passionate about this intersection of oncology and sexual health. There are the larger bodies, so the International Society for Sexual Medicine, ISHWISH. So there are several of these out there. Really, I would encourage providers and clinicians to get involved in these organizations, especially if you're reflecting back on your own medical training or graduate level training and saying, yeah, I do not know nearly enough as much as I should about these topics. There's such great, robust, still small, but robust groups of professionals organizing and doing research and education on these topics.
That's really encouraging to know. Thank you so much, Dr. Vencill. And I will list those that you mentioned in the show notes so that we have those easily accessible for our listeners. And I just thank you so much for joining us today and sharing your expertise on this very important topic. Sexual health is a vital part of quality cancer care, and conversations like this help us all show up with more confidence, compassion, and skill. Listeners, be sure to check out Dr. Vencill's book, Desire, an Inclusive Guide to Navigating Your Libido Differences in Relationships, available now on Amazon. And if you found this episode useful, please share it with a friend, family member, or even your oncology care team. And be sure to visit our website, fucancer.health, to learn more about our digital health tool that's revolutionizing cancer care. Until next time, I'm Juliet. Thanks for listening. The conversation doesn't end here. Join our community today at fucancer.health for trusted education, real community, and resources. We are here for you every step of the way.